Hello viewers, welcome to Practice with Pushpen. Today I'm joining you from outer space and Dr. Pritha Ghosh is joining us from somewhere above the Golden Gate Bridge in San Francisco. Maybe all this preparation for MRCS ENT OSCE has made her suicidal. So she has chosen the Golden Gate Bridge, which is a very favorite suicide destination for people, if the statistics are to be believed. In today's communication skills station practice, we are practicing obtaining informed consent. Again, in some stations, you may not get the surgical procedure mentioned explicitly. So you might only get the disease. Sometimes you might not even get the disease, just the symptom. You have to obtain history, arrive at a diagnosis, and then take informed consent. So in this case, at least you have the diagnosis, and you have to decide what the appropriate surgical procedure is, and then obtain informed consent from the patient. I'll play the role of the patient. Dr. Pritha Ghosh will play the role of the doctor. She will have 7 minutes. But in MRCS ENT OSCE, during the communication, you don't get a chance to look at the question. You can't refer back to the question. Once you have let go of the question, you can't go back to it. So it's very important to read the question very clearly and pay special attention to the tasks. Here it says obtain informed consent for the required surgical procedure, nothing else. So decide what the surgical procedure is and obtain informed consent for that. And of course, you'll not be able to look at the time either. So you have to practice properly so that you can finish within 7 minutes. So Dr. Pritha Ghosh, when you're ready, I'll stop sharing the screen and start the timer. Are you ready?
Yes.
Okay, please start.
Hello, I'm Dr. Pritha Ghosh and I'm an ENT doctor in this hospital. May I speak with you?
Yes.
Could you please tell me your name and date of birth, please?
My name is Tom Anderson and I'm 45 years old.
And how may I address you, sir?
You can call me Tom.
All right, Tom. I see that you were having some infection in your ear and having some problem with hearing. And I guess a procedure was suggested. I was just wondering, what do you already know about this condition, or maybe details of the procedure if anyone has told anything to you?
So thank you for asking me that question. I don't really know much about the procedure. I was hoping you would tell me about it. But I do know that I have a severe infection of my ear, my right ear, and
Yes.
I've been told that medicines are no longer going to be the answer. So I need to undergo a surgical procedure to get rid of this infection. I was hoping you would tell me more about the surgical procedure.
Yes, well, I am here to discuss about the surgical procedure and obtain consent from you. And I will be telling you in details about the procedure so that it can help you make up your mind. And if you have any doubts, please feel free to ask. Okay?
Okay.
So as I see from your case file, you have been diagnosed with something known as cholesteatoma. Was that explained to you?
It was explained to me as a severe infection of my ear.
Yes, well, it is a severe infection of the ear and it does have a few adverse effects if left untreated. So, therefore, a surgery known as mastoidectomy was suggested to you.
What adverse effects?
Adverse effects like there is infection which can actually, if left untreated, can spread to the surrounding structures, and it releases some enzymes like certain substances, so it could damage the surrounding structures and can also spread to the brain.
Okay, so surrounding structures meaning brain.
Yes, to the brain and also the bones that are there in the ear. Well, first let me tell you about the anatomy of the ear. That might help you understand the condition better.
Okay.
So our ear is divided into three parts: the outer ear, the middle ear, and the inner ear. So the outer and the middle ear are divided from each other by something known as an eardrum. And this middle ear is basically contains bones and is an air-filled space. So this cholesteatoma is a debris which releases certain substances which can erode these bones and also erode the other surrounding bones to spread into the brain, causing certain adverse effects.
What adverse effects in the brain?
Like it could lead to some infection of the brain, it could lead to convulsion, it could damage the nerve that helps in hearing, it could damage the nerve that helps with balance. These are the adverse effects.
Okay, sounds very scary.
I understand this must be really scary. Well, I don't mean to scare you. And hence, to get rid of this infection completely, a surgery known as mastoidectomy was suggested. So, for this procedure, we will be giving you general anesthesia where you will be asleep throughout the procedure and you will have to fast a few hours before and after the surgery. And I will schedule a meeting with the anesthesiologist where you can ask them further questions if you have any. And as for the procedure, we will be giving you skin cuts behind the ear. And then there is this bone which is there behind the ear, which is known as the mastoid, which will, the covering of this bone will be removed and the infection from that part will be removed. And then the wound will be sutured and a head dressing with ear wigs, like dressing in the ear, will be applied. This head dressing is removed on the same day, and the ear wigs are self dissolving. So you can go home on the same day.
Okay.
All right. So the benefits of the surgery is that you can get rid of this cholesteatoma completely, which will actually help you with a safe dry ear. And then we can actually help you with, and we can prevent the further complications or the adverse effects associated with it. Am I able to explain?
Yes.
And there are a few risks associated with the surgery. Would you like me to tell you?
Yes.
Well, the risks are general risks, like they could be bleeding, there could be infection of the wound, and there could be scar formation. And then there are some specific complications of the surgery, like they could be, as I said, that there is a nerve which helps in hearing. If the disease is extensive enough to damage this nerve, then there could be hearing loss. There's this balance nerve, if damage could lead to dizziness. Then there could be uh, there's this nerve which supplies the muscles of our face. If damaged, there could be weakness of this facial muscles. That's about it. And yes, there is this nerve which actually supplies the taste to our tongue. If that is damaged, then it could lead to altered taste sensation.
And what about my hearing?
Yes. Well, since you're already having this hearing problem, in this, as it is a very serious condition, we prioritize removing the disease itself, and hearing is secondary. If, as there is already a damage to the hearing, a second stage surgery might be done where we will reconstruct your hearing, and in the meantime, we can also provide you with a hearing aid.
And is there no possibility to improve the hearing in the first operation itself?
Well, we can do that, but that depends on the extent of the disease while surgery.
And any precautions after the surgery?
Yes, the precautions that you have to take are like you have to take 2 weeks off from work. You cannot swim or dive or fly for the first 4 to 6 weeks. And you have to avoid getting your ears wet for about 4 weeks. And then you will have to follow up with us after a month so that we can check the condition of the wound and the ear after the surgery.
Anything
There
else?
could be some, the
So that
earwigs that we will be.
So that is the time. I can think of 2 or 3 more precautions that you could mention. But again, as promised, the feedback will not be given on YouTube. It will be given without me recording it and making you look not as intelligent as you are. So, but then kudos to you for the effort. And I hope we get to practice again. And I hope this was helpful to the viewers. Again, this is my effort to teach you how to practice. See, we are practicing from outer space and San Francisco, so you can also practice with each other on Zoom. It's very important that you do practice. Thank you, Dr. Preetha Ghosh, for practicing with me. Bye-bye.